So who should be getting a facelift? I have all types of patients who come to me, they're looking for fillers, they're looking maybe for facelift, they're looking for threads. And then sometimes we end up on recommending to them to get a facelift. Ideally, the person who should be considering about a facelift is someone who has some degree of droopiness or changes or aging in their mid-face, but also in their neck. Facelift addresses both areas. Now, sometimes with the facelift, we can also address the brows, but for the most part, a typical facelift addresses the mid-face and the jaw and the jowl lines. So common reasons for facelift is having some droopiness, some defined nasolabial lines, having jowl deformity here where the sort of the tissue hangs below the jawline, and then obviously some loosening of the neck. If somebody has those three, for the most part, facelift is their ideal choice. Now, for people who have maybe one or two of those three things, there may be other procedures where more focused at those. We can sometimes do just a neck lift. Also, there's such thing as mini facelift, which is again a facelift, but it's a little bit less aggressive than the typical, for example, deep plane facelift or subsmash facelift that we do in patients who need a lot of elevation and basically a lot of rejuvenation.